In this discussion, we're going to address why to conduct drug testing with patients on opioid medication. As a primary care provider, I know the challenges we face managing pain patients. This is in the context of the volume of patients we see, the short office visits we have, the pressures that we don't have enough support, the financial pressures. And I know for me to ask you to do one more thing, you think it's undoable, but I'm doing it. I sit there with the patient, I screen them, I look up the prescription monitoring program, and I don't think I'm any better than any of you, so I think we can do it, and I think it's incumbent on us to do it. So to begin, I'm going to give you highlights on some of the key reasons to implement drug testing. First, we have to understand the context. We were taught that pain is being undermanaged, that this is an epidemic of pain management, and we were taught, largely by this panel and myself, that opioids were safe, that they managed pain effectively, and what happened is you listened, and opioids, namely hydrocodone, became the most widely prescribed drug in America. The problem with this is when a drug becomes available widely, it's also available for abuse, and that became the #1 drug of abuse in America, the opioids. You can see here that overdose deaths in the United States, 36,000 plus have died from drug overdoses. 12 million patients are using prescription painkillers non-medically in the United States right now. Of those patients that are overdosing, more than half of them are from prescription drugs, and 3/4 of that are coming from opioids. And as you can see also, the overdose deaths in the United States have more than tripled since 1990. It's also important to note that the patients who exhibit aberrant behavior, we suspect that something is going on, but we're not always good at identifying behavior that isn't readily presentable. Now, just as an example of this, if you look at this Katz study. Now, Katz is a pain expert. He has a pain clinic. He's very good at identifying these behaviors. So he predicted who he thought would be in trouble with drugs. And he found that almost half of the time, he didn't identify pain patients who were having trouble by behavior alone. So you need more than just your own visual understanding. Now, I understand you say, well, I know my patients. I understand the context with which they're taking their drugs. I'm not a pain clinic. I see my patients over and over. They've been on medicine that I've been giving them for many years. I understand, but this study shows that even the best of us have trouble identifying patients that may not be using the drugs according to the way they should, misusing or abusing the drug. So I think in that context, urine drug testing can be very helpful in identifying these behaviors and helping us managing appropriately patients who are taking these drugs. And as you can see from this slide, multiple organizations recommend urine drug testing as a standard by which you follow patients. The Federation of State Medical Boards is one of those listed organizations, and their policy has been adopted by the majority of states. You may be worried that the DEA is monitoring you. It's not the DEA, it's the Federation of State Medical Boards guidelines and your medical board that is monitoring you, and they have recommended that urine drug testing be a part of regular monitoring of patients taking opioids. So it's important for safety of the patient, for safety of your practice, for safety of the society that we keep in touch with urine drug testing, because it is an important tool to manage. And we already know that you're not using it. Only about 10% of practices are using it in the primary care setting on patients taking chronic opioids. So we need to do a better job, and I think we can.